tell me.
Midnight, past midnight.
Yes.
0:30.
Yeah.
0:35.
Yes, past midnight. Yes. 7 years. Every night it's there, and we are happy to be there. I was the only show in the entire world. Entire world, only one show. Some other shows come for 1 week, 1 day, 1 month, and they go. We've been there for 7 years, so we are very proud to be there. And Asta is a very big brand, and
सुजोग के बारे में कुछ बताइए.
नहीं, अभी नहीं. We'll talk of that. You can go on the YouTube and the help library. You can search Sujok, and there are many. Even our lectures are there, so you can go into the past. Today we are here for discussion. Iridology. Okay. The reason why I like this is I was recently traveling abroad. I travel a lot. My show keeps us quite busy. So I was traveling abroad, and I met a lady from Philippines while I was in Kuwait for 1 month on invitation. And she was talking about iridology. And I realized that there's so much in this world that we don't know. So when I came back to India, I immediately started researching on iridology. And accordingly, I got some software from abroad. I paid online, I purchased the software. And I purchased, then having a software doesn't work. Then you need hardware also. Then I had to get hardware also. So I had to import the iris camera. We have both. So first we'll talk on what is iridology, how it works. And then since you are less people, you are 5. I was thinking if there were many, we would only take 1 or 2 samples. But we'll take all your scans of your iris. Normally we charge, but natural, it's chargeable. But here we'll take 5. And we'll show you how different each one's eye is. Left to right eye will be different. So that's what this iridology is about. Okay, it's a very age-old science. It started somewhere in the late 1800s. It was by a Hungarian doctor. He was when he was only 10 years old. He was playing with the owl in his courtyard, And the owl's eyes are visible. They're very big. So he looked at the eyes, and he didn't see. It was a normal eye. But while playing with that owl, he broke the leg. And the moment he broke the leg, a streak appeared in the iris. Yeah? Because the eye was black, he could see a white line, which was not there earlier. I have a book which I've downloaded, and in that there is a photograph of an eye, of an owl with a, that streak. So that he was only 10 years old at that time. So that, whet his appetite, and he went on to become a doctor, a allopathic doctor. And when he became a allopathic doctor, he had chances to go into the morgue, into the hospitals, and he would observe, ailments and look at the eyes, and he would make sketches. So that made him write a book. I have a book on my mobile, which is written in 1990. And the sketches, today you have mobile cameras, you have very expensive cameras. In those years, he sketched the eye in different colors. Whatever he would see, that author sketched those eyes individually.
So at that time these scanners were not...
Yeah, not there. Scanners came only after 69, because I remember in 69 we were in Africa and we had that Yashica camera. We used to look on the top. And look at the top and take a photograph, the real camera. Then it came to the front camera. Now it's coming to digital, now it's coming to your mobile. Now it's coming to your pocket pen. So that's the technology. But we are talking of the late 1800s. Okay, so this is introduction to the constitutional iridology. Why iridology? It is one of the most useful tools that I've known can analyze. Okay, we have our constitution it has inherent physical and emotional makeup. All these things make up our physical and emotional thing. But they're all reflected in the eye. You'll see. This is a disease tree. We have mental and emotional problems, then we have nutritional deficiencies, then we have physical problems, then we have toxicity. All these things give us a variety of illnesses. Okay? Different types of combinations will give you different types of illnesses. And they all have different things. The understanding the constitution, disease, environment, remedy, they come to the constitution. This is how it works. Okay? Simple. Constitution में disease आ जाएगा, environment से होगा, remedy पता लग जाएगा. So this is how the constitution works. This is essential of the eye anatomy. This is the eye. We know the iris, we know the lens, we know the pupil, we know the cornea. So the entire system of iridology works with the iris. Okay, on the iris. What eyes reveal? The eye can tell us the person's genetic weakness, strengths and weakness, including the organs that are affected, the patient's inherent constitutional strength, personality tendencies, and also the nervous systems. The eye does not tell us the actual disease. It will give you a location. It won't tell you it's cancer, but it will give you the location of the cancer. Location of problem. Location of the problem. Okay, because it's not written there. You can analyze, because it's very specific locations. Just like in Sujok, we have all the locations right on the palm. Okay, that's what drew me to this iridology. I said there's such a lot of similarity between the eye, the human body, everything is similar. The ears, the nose, the eyes. But this is something different, a new dimension for us. Because here we are not able to analyze the locations. We can see the pressure points which are sensitive. But here it's direct there. And since I've got the software, my job is simple. I'll explain how the software works. We'll give you them. Okay? We can't find out the presence of parasites and infection through the eye because they are not demarcated. But we can know that there is some sort of immune system is reduced. Okay? How the person is supporting his health through diet. We can't say that through the eyes, through the study of iridology. These are the major constitutions. We have three major constitutions. One, we have the blue eye, then we have the mixed color, and then we have the brown eye. These are the three basic eyes. We Indians, we fall in, I believe, the brown eye. Majority of Indians, we fall in this. This is the blue eye. This is the lymphatic system, lymphatic type. They have a few problems which they are inherently, more capable of getting these problems.
It's lymphatic.
Yeah, the lymphatic type of eye, that is the bluish eye. They will have, they are prone to lymphatic congestion, they'll have respiratory problems, they'll have urinary system problems, and they'll have mucous membrane problems. Okay, that is like, say, the Western culture. So in the West, the eyes are basically blue. So those type of people suffer from basically these type of illness. And this is through a lot of medical research. This is not anything which I am speaking. It's available on the internet and very, very old. This is the biliary area. Again, these type of people suffer from gastrointestinal problem, the liver, the gallbladder, the pancreas. These are the areas that will be mostly affected in these type of people. Of course, it will be very refined, very localized. We'll show you how the areas come into it. But this is a basic overview of the different types of system. This is the hematogenic. This is the Indian type of people, brown eye. Okay, what do we suffer from? We suffer from circulatory disorders, high risk of heart disease, right? India, capital of heart, gastrointestinal, liver, gallbladder, minerals, and glandular system, hormonal imbalance. Can you imagine how the entire Asian race comes into this? We get majority of these ailments.
So it has to.
Right, I didn't say we have to, I said majority. Not has to. Somebody will have circulatory problem, somebody will have gastro problem, liver problem, gallbladder problem, minerals, tendency to have difficulty storing the minerals and more prone to hardening of lymph tissues. That's why we get sort of tumors in our bodies and all. Less circulation. We have a lot of hormonal imbalance. Thyroid, we have seen children as young as 7, 8 with thyroid. Very young people are coming for this problem. These are the subtypes. So these type of problems, you have different types of problems that they will get. They'll get uric acid, then they'll get scurf ring. There are different locations of the eye are affected in different types of problems, and a different sign will point at a different problem. Okay? So you see the signs ahead. These are the over acid areas, febrile areas of risk. Blue iris with the whitish fibers, they have a tendency of high acidity in the tissue due to possibly kidney weakness. Then white blue iris these are the different types of problems that they will have. You see the different types. See that? Uric acid areas of risk. Always have a tendency of removing acid from the body. Increased risk of joint problems such as gout, rheumatism, arthritis and back pain. Increased risk of kidney stone and UTI. So what happens is basically different parts of the eye are affected in different types of ailments because they represent a different part of the body. So it's very, very defined. We have the sketch, we have this. If you want to take a xerox, this is a hydrogenoid subtype lymphatic system where they are pointed out as black. Those are the locations whereby it's analyzed. And when we have the software, that becomes very simple. You don't need to worry. We'll do it. This is the subtype biliary. You can see the biliary conditions. These are the areas of risk of the hydrogenoid areas. Increase of the lymphatic type tendencies, greater tendency for mucus, prone to hyperactive immune systems, allergies, asthma, autoimmune conditions like rheumatoid arthritis. Then their dislike and discord and contention, want harmony in their life. I've been reading so much about it since I've come back from Kuwait. It's so possible that you can tell somebody's desire also. I've got a book, I'm reading through it, and that author has written that just by looking at a part of it, at the location of the brain with some white cracks, she told that man, "You're having some sexuality problem," and he got a shock. And he said, nobody has actually ever asked me about it, but it's a fact. Then she goes on to explain how he discussed it with her. It was really very well written by her. But she said it was so simple. I just looked at the location of the brain and there were white cracks in that part of it. So she connected it to sexuality. So it's such a deep science that it really is, wonder. When I read certain cases in her book, I fail to understand how so much research went into it and so much documentation and how people could correlate with so many problems and document it. Because it's all documentation where they do it, then they do the research and then the people proceed with that. It was a very good way that she explained one case. This is a rim, scuff rim. It's right on the outside. You can see that blue, that darkness, greyish part within that bluish eye. You can see that scuff rim. This is what it suggests. The outer part of the ring, outer part of the eye. What is the outer part of our body? Is the skin. So the outermost part of the rim of the eye represents your skin system. So if you see somebody with a darkened skin system, you can, a darkened ring around the eye, iris. It's basically involvement of the skin. In certain cases, psoriasis. And even location of psoriasis can be shown if you understand the division of the entire eye. You have 0, 1, 2, it's like a clock. So 0 to 12, you have different locations. So in each of those quadrants, they represent different parts of the body and different organs. So immediately you can say in which location that is analyzed. This is lymphatic disease. You can see again certain locations. You can see that? This is hematogenic. You see how we normally see such eyes. I've seen it in my father's eye. I would always wonder. But these are his, it's impaired, over a period of time when you're 75, 80, cardiovascular disease, he does have it. He is very strong. Very strong. He'll never say he's not okay. We sometimes feel that he's not okay, but he'll never share that he's not okay. This is perfect, hard-headed. Because he was in the Air Force and all, so very hard-headed, inflexible. Because that's how when you're in the army and in the armed forces. So this is perfect. I was analyzing it with him. Then also glandular problems like pancreas, glucose metabolism. He had some problem of diabetes, but that we solved within 1 month. So very good. This is a structural integrity, resilience. This is how it shows. These are the type of problems. The active anxiety, these type of people suffer from anxiety. Resilience indicates our ability to work hard and handle physical stress without suffering in health, our ability to resist illness. All these problems can be analyzed through the eye. This is the resilience. You can see high resilience and lower resilience. Please, please. You can see that flowering effect, no? Quite severe. You can see that homogeneity over there. This is another one. This is the neurogenic area that are risk. What happens is the eye is basically divided into five concentric circles. 5 concentric circles. So each of those locations is one part of the body, one system of the body. So from that it's analyzed when they came over there in that system. When we make your eye photograph over there, then we'll bring out the entire division of your eye like this. It just expands. There's another one. Connective tissue areas at risk. Tendency of less structural strength, increased risk of organ prolapse like varicose veins, hemorrhoids, hernias, subluxations, difficulty holding on to minerals, require longer recovery time from injury or illness, emotionally the spontaneous personality type to be discussed. This is another flower. You can see the flower? The structure and personality tendencies, same as connective tissue types. General weakness of the glandular system, also prone to weakness of the digestive system and intestinal irregularity. May also include weakness of the heart, liver and kidneys. Anxiety type. These are the rings. See these rings? You see these rings? Concentric rings. Neuromuscular tensions and stress. Risk of disorders related to tension such as tension headaches. Brain. It's all brain. No? Stress is from brain. Tendency to be hyperachievers. May suffer from mood swings, depression, hysteria, and attracted to stimulants. All brain. No? It's all brain. Basic personality types. These are the different types of personalities. Again, emotion and spontaneous character. Try to be open-minded, flexible thought processes and attitudes. So different types of eyes will give different types of ideas, personalities. So because and over a period of time, if proper treatment is given, these areas vanish. Okay? There have been documented cases where I've read so much on the internet, and the doctors have proven that it is a problem of one location or one organ, and they were given some. Basically, what do you give treatment? You give either acupuncture, you give diet, you give detoxification. Ultimately, this is a mirror of your eye, mirror of your body. So the location is there. So you understand, the therapist understands the location, and he gives you a regime to follow. It could be diet, water, oxygenation, whatever. So when that organ starts getting better, improving, these patches start changing. They go away.
So means one is having anxiety disorder.
Yeah. If it's treated properly,
like marks will go.
yeah, those marks will slowly vanish. That's the best part. No? It's a mirror of your health. It was not like that earlier, but over a period of time, because of our ill health and our toxins, this book that I have of 1919 shows toxicity of all the, because he was a medical doctor, so he analyzed coal tar, cyclic acid, DDT, because he was a doctor, so he analyzed all those situations and he located them in the eye. Okay, and then he said, look, this is a toxicity in this organ, it's visible here. So when the patient was given detoxification, they vanished. And the health improved.
It's one of the method of diagnosing.
Yeah, it's a method of diagnosing. It's not for treatment. It's to help us diagnose. Okay, this area can be affected because if a patient comes to us in Sujok, they tell us we have diabetes. But with this method, we've been able to now add another method to help us analyze which other organs are affected. And we can, ultimately in Sujok, we work on organ areas. Here we are able to add in certain more areas which we were missing out earlier. Okay, so it's a real good thing. I have another software here. Yeah, I have another product.
So it's a never-ending process. this.
No, health is never ending. You have to improve your health. So you have to spend time for it. It's not a question of never ending. You just have to be better and better.
So it will go on progressing. It is not it's okay now this is the way.
Yeah, once we tell you to drink more water, then you should drink more water. When you are told to take some vitamins, then you should consume some vitamins. I remember I was in a conference recently, and there was an orthopedic surgeon. He came on the stage and he was talking of the spine. And while he was talking, he said, I believe that I would recommend to everybody that after a certain age, you should all consume some minerals. Coming from a doctor, I was very happy. And when he came off the stage, I said, sir, you didn't tell which mineral to consume. He said, that's very good. He said, what were you listening to? I said, I knew all what you're talking. But when it comes from a doctor that you should consume certain things, and he said, yes. He says, nowadays what happens, our diet is deficient of so many things that we do not take in sufficient. So then you should take good minerals. So then he gave me one or two names. I can't discuss the names, but they are there in the market. So he said, they have to be consumed regularly after a certain age, because our body doesn't absorb them properly. You'll see it now. Analytical thinking characters, these are the type of people who respond with short sounds like ooh, ah. They have this type of eyes. This is the location of the brain. So it comes from there. And these are the active type of people. They have different types of, these are the type of eyes, those type of, and because the organs are involved, so they have those tendencies. Because the eye has got locations of organs. Each organ represents a certain energy. So it's all boils down to the five or six element theory of Chinese. Again, over there. This is inner directed type. These are the introspective and reserved people tend to keep thoughts and feelings inside, need to feel safe before they will open up, observant of others, need to learn to express what is inside of them. Outer directed people, you can see how it is compared to the earlier one. These are the outer directed. Expressive, open, very, they attract a lot of attention, the achievement oriented. These are all different types of eyes. These are different types of eyes that we have. Okay, so basically, these are examples of different eyes. Each area represents, each part of the eye represents a different location. Now we have a software. I will show you how it works. I will, because there is more now, I'll just do one or two, then we can do the other later. This is the location of the eye, the entire system. Okay. What we have is, we have different locations. In that we look for cracks, we look for pigmentation, we look for stress rings, we look for congestions, we look for cholesterol rings, we look for damages, we look for holes, we look for mounds. Everything is visible, not so small. But when we take it now with the Iridology camera, I have the camera. Huh?
Biometrics.
Yeah, we have. I have the camera. I have imported the camera. I'll take the thing, and you'll see how it works. Okay, that's the system. You can see. That's your right eye, that's your left eye. Those are the location of organs.
So are they affected light brain or
Yeah. The eyes are connected to the brain, of course. So that's why it's divided into two parts, right part of the body, left part of the body. So some organs are on the right side, so they're represented on the right. Some organs are left and right, like the large intestine, so they're represented in both. You have kidneys on both, one side each, so you have right kidney and left kidney in different locations. So everything is different. It's all there. Okay? The left leg, the right leg, the bladder, the prostate, everything is there. I'll show you how it works. So this is, so we have the login name, we have the password, so I've logged in, so now I've gone in. So now I just type the customer name. You'll have one sample, please. yes.
Excuse me, sir.
Mr. Krishnan is in Chennai, we were in Chennai last week. So these are his iris eyes. Okay? So what we do is, we normally take two samples, two eye, one eye, two photographs. It comes here. That's the right eye. Then we take the left eye. Take two eyes, one each. Then what we do is, now we want to go in for eye analysis. We go into the eye analysis. So this is the one eye, this is the right eye. Okay? So now you see how big the eyes come over there, right? Well, now after that, we know it's brown color. So now we want to set the eye. Okay? So now I'm bringing the stylus into the center of the eye. Okay, once I click in the center of the eye, okay, that's clicked. Now I have to demarcate the black area of the eye. Okay, done. Now from there to the outer part of the eye. You see the divisions that are opening up now? Now we have divided the eye into the locational part. Now the eye is divided into the the locations. So that's done. So we click. Now we go into the. Now we set. It's now set. Okay, now it's set. Now we click on the brown. So now we go in for the analysis. Okay. So now what color is that eye? Brownish. So we click on brown. Okay. Now we click on brown. Now we go into the holes, Okay. So we analyze holes, lumps or cracks. Now where is the hole? Is that area a hole? It's visible, na? That hole is visible. So we click on that. So now that's the location. This is cecum. Okay. Diarrhea, constipation, exchange of abdominal problem, could be a tumor, rectum bleeding, abdominal pain, loss of weight symptoms, possible sickness, cecum laminal syndrome, prolapse. These are the situations that could be available to the client. So then we want to add it to the report, then we can just add it to the report. Then we go next. Then we can analyze this hole over here. Iris color, we have to reselect the iris color. Iris color is brown. Then we go into hole. Then again we analyze that. That's the transverse color. Okay? Lower abdominal discomfort, loss of weight, malnutrition, anemia, colon impacted syndrome. This person was having colitis early. This patient had colitis early. Okay, colitis is basically involvement of the large intestine. Mucus, loss of weight, intestines are not functioning properly. So it was clearly shown. Okay, so anemia, he's got anemia. We add that to it. Then if you want to take brown eye, and then you could take lump. Now if you think you have lumps over here, you call that a lump, this is also a lump, right? That's a neck brown lump. Bad sleeping, cervical pain, dizziness, shoulder pain. He was having less sleep. We asked him, he says, yeah, difficult to get to sleep. He has got some problem in the cervical. So we could add this into his report. Then we could take again brown eye. Then we take the cracks. You know, these are cracks. Can you see this vertical radiating out? Can you see those long cracks? Even here, na? You can see them, na? Like a flower. These are cracks, even here. So these cracks. Now you want to click on that location. nose, stuffy nose symptoms, chronic nasal inflammation, sinusitis. Fact. You know why? That's mine. This is my our unlikely. It's a fact. I have sinus congestion. I have pain in my neck. I suffered from ulcerative colitis for 13 years. I was losing weight. So I just tested mine. Okay, how does it really show? It's a fact. Okay, I do have sleeplessness at night. It takes time before I go to sleep. But once I go to sleep, I do sleep very well. So chronic nasal inflammation is there. Stuffy nose is always there. And we can again find some more cracks. Here also cracks. Mouth ulcers, watery soil, extremities are, my arms get numb sometimes. And when I sleep, confusion there. Then small intestine malabsorption syndrome.
Speak louder.
Okay, explain. Okay. Then the intestines are not absorbing vitamins properly because in colitis your intestines become weak, so they do not absorb vitamins. Then you do feel tired, lethargic. All this is a fact. Because I'm in this for 13 years, but we were always missing something. Because basically we treat the best. We have very complicated cases. Our patients are like member of parliaments and all, big people. But we were feeling something deficient because everything is not visible in the medical reports. But that's why when I met that lady abroad and she was talking about iridology, I said this is one thing that I've never given it a thought. I was aware of it, but never gave it a thought. And there's no book available in this library on iridology also. We were here in December and we didn't find a book on iridology. I'm trying to get some more. I've purchased one or two. I'm getting one or two more. So this is really a wonderful method of analyzing. It's giving us a chance to analyze the patient better, not the illness, the patient better. Because I can't say illness. I can say we are able to help and analyze, his health status of organ involvement better. And it gives us a chance to help him more because if something is visible through this is one software. I have another one. I have two. That is on a different computer because that cannot be duplicated onto another computer. So that's on the laptop. So that is more detailed than this. That's very detailed. So I have two softwares. This is very simple. I have loaded it on this and it works. So and what we can do is basically once we see these symptoms and these locations, then we can we are in a position now, better position to help the client through detoxification and observe after a few months, again take a photograph and again analyze, because you can see once you have this you added it to the report, then we can compare. Once you close, then you can have a customer report over here. You can select your customer, you can compare. So now look, there's no report previously available, so you can compare. So there's a situation where we can compare same clients after a few months with the dates, and then we can analyze both the eyes together next to each other and see what's the improvement, because it will be visible over a period of time. So this is a very wonderful thing. I'll show you one more thing that we have. Okay. No problem.
This software is available.
Yeah? Software available on the internet from. I've got mine from Spain. Mine is Algaris. Algaris, and this one is with this. These are only software. So these I imported this from Hong Kong. They are not available anywhere in India. So I went online from eBay and I got it. I think hardly anybody in India has this today. Nobody's got iridology today in India. Okay, now I'll show you one more thing. this is another. Now this is a very simple one. This is just it's not the ultimate, but it just gives us a idea of the health parameters of the patient involved and how we could improve their treatment part. You know, it's not to diagnose, but it's just to help the client understand the. You get 36 reports in this, and once you are able to analyze from those reports, we can So this is the quantum resonance magnetic analyzer. What we basically do is we are able to do the testing of the client. Okay, please select a client. Okay. This will just be one. Okay, so again this one. This was this thing. Then what we did is we now search for. I'll show you one. Just it. What this basically does is it gives you 36 reports of one client in 60 seconds. Again, set up in the computer. I just set it up in this one. What we do is basically, this is the setup. Let's okay. One person, please come. Where we are? Please. You have to hold this in your hand, and you have to be very gentle. Please remove your ring. Keep it here. Your metal ring. नहीं करती. Somebody without any metal. Without any metal.
Even belt.
Belt.
Okay. Remove the belt. Take out your mobile. And hold this very gently. अच्छी तरह पकड़िए. Breathe slowly. But धीरे धीरे सांस लीजिए. No tension. It's analyzing a different hormones. you know what happened now? Karan was only 7 years. We just because this age is 7, right? So the reports will be less. You know, it's 7 years old, right? So no, we didn't add all his parameters. But normally when they're added, you get 36 parameters. When we added a 7-year-old age, we got only 4 or 5 reports. So depending on what age you add in, you get those many reports. So if we had added, I think you're around 38, 39. How old are you? 40, yeah. So if we added all his particulars as age 40, we would have got a lot of reports. Now we will get it. You see, this is of him. These are his test reports of his, element report, trace elements. So much calcium, iron, zinc, selenium, phosphorus in his body. These are his.
So the normal range are
Yeah, these are normal range. You can see the green part, no?
But
Normal.
for age 7.
Yeah, for his body. It's for his body. बेशक एज 7 है, मगर because we put in a wrong age, we just added into another client's name. I didn't add all his details. But these are his actual look. Say 80 to 90% are fact. I don't say this is 100% true. But this is 80 to 90%. You can see he's healthy. It's visible from his body. He's muscular, he's got a good age, his hair is good. All his, parameters compared to, if you see vitamin C, vitamin D and vitamin E are less. Vitamin B3 and vitamin B6 are also less. So these are a few vitamins which are reduced in his body. Otherwise vitamin A, B1, B2, and vitamin B12, these are in good report. So there is, it's not that bad, it's a bit less. See that? So similarly, we can see the amino acids. These are the different types of amino acids which are, they're okay. Then we can see the coenzyme reports. These are his coenzyme reports. So these are basically on the mineral level. But if you see the reports of the dossier, let's see the dossier. Just take it open. Yeah, active a bit. Intestinal bacteria is good. The liver function peristalsis is less. Then this is the gallbladder analysis. Normal, a bit high. Serum globulin is a bit high. Pancreatic function, normal. Kidney function, normal. Blood urea nitrogen, a bit high. Mildly abnormal. Lung function, normal. Brain nerve, normal. Memory index, less. He's getting old. He is 63, so memory will be reduced. He is 60. This gentleman was in Chennai, 63 years old. So memory index नीचे आएगा ना. Bone disease. Bone mineral density. You see, degree of osteoporosis, moderately abnormal. Rheumatoid disease, bone disease. It comes. He used to take steroids for his illness. So this is, when you take steroids, then you have some sort of problem in your classification.
What was he suffering from?
He had colitis, then he had constipation, then he was old, 63 years old. Blood sugar, normal. He's not diabetic. These are the trace elements. These are the vitamin elements, amino acids, coenzyme, endocrine reports, normal. He doesn't suffer from any. Immune system is okay. Human toxin report, heavy metals toxicity, some toxicity is there. Basic physical, mental power, water storage, shortage, hypoxia. He's getting old, less oxygen to the brain. He's not allergic to any things. Very slightly allergic, but it's okay. He used to sneeze when he used to have go in for dust and all. He used to have slight sneezing. So it's shown in his dust allergy, smoke allergy. He's that type of person who would not allow somebody to smoke in his home. So because he's allergic to smoke, so it shows in his thing. I asked him, do you like smokers? He says, no. When people smoke, I tell them don't smoke. I said, yeah, you have a slight allergy, so you don't like smoking. So he says, yeah. As it's mentioned, it's visible here that you don't like people who smoke. Obesity is not obese. His slim. His weight is around 64 kilos. These are the skin analysis reports. Dryness. He's getting old, no? So you can see the dryness part. You know that it's normal in the green. It's a bit abnormal. At the age of 63 it does happen. Eyes are a bit, he's got a number, so it's visible. Okay, the eyes are not in perfect shape. Collagen, channels and collaterals, pulse of heart and brain, normal. Blood lipids, prostate, no problem with prostate, normal. Real sexual function is normal. Sperm and semen, normal. So in places of, for ladies, sperm and semen की जगह पे ovaries आएगा. Instead of prostate, it will be uterus and ovaries. So those are the two reports that will change for male and female. So these are 36 reports. So the idea is that it's these two methods of diagnosis help give a better picture. You know, it's instantaneous. Like this report can be, regularly done because the blood parameter, the changes in the eye would take a lot of time, maybe 6 months. But the blood parameters here in this report can be analyzed maybe within a month. Within a month, we would be able to compare the differences in the indices because it takes around 21 days for you to get new blood, 21 days. So within 1 month of regular proper treatment and diet or maybe some vitamins or some products like maybe aloe vera or any of these wheat grass, barley grass, these products which are generally very good for the body to help the body detoxify would ultimately show it much faster and earlier in these reports rather than in the eye. In the eye it would be a prolonged maybe 6 months. So these are two very good methods of helping people improve their lifestyle, getting better. And then here we get, we are able to give recommendations. You have a compositive report. So these are the expert advice. On this side you can see the cardiovascular report. Work and rest together, make emotions stable, eat more foods for adjusting blood fat, such as fungus or fungi, vegetables and fruits, and eat less foods with high cholesterol, foods that have high salinity and high fat foods. Then because of the gastrointestinal problem, you should eat more non-stimulating products. Then eat more fruit fiber. So whatever system is affected has got a recommendation at the end. So the idea is that the client is able to understand that I should, like the brain, reduce stress, pay attention to rest, eat less meat and food with because of that cholesterol, eat more vegetables, quit smoking and drinking, and go for appropriate exercise like walking, jogging, playing or tai chi. Then because of the bone mineral, have reasonable diet, supplement adequate calcium, usually pay attention to appropriate exercise such as walking and jogging. Rheumatoid disease, eat less bean foods and soya products, and do not eat stimulating food like tobacco and alcohol. So ultimately, those things aggravate those problems. So ultimately the idea is to, like blood sugar, eat less but have more meals, have a fix because it's between 2.9 and 3.5. Eat light food, consume less sugars. So the idea is we are able to, like, we have deficiency of vitamins, supplement using trace vitamins or some products because the parameters are low. Coenzyme, human toxin, heavy metals, allergies. Please stay away from allergies to avoid allergies. So they've given you skin, vitamin C, caraway, red turnip, because this will give you a lot of oiling. Choose the right IK product. Number of easy to liver, the liver is involved. Then kidney, and drink lot of soups for the eye, collagen, prostate. Have rest, pay attention to personal physical health. Avoid wearing too tight or gas tight underwear. And quit smoking. Sexual strength, supplement vitamins and trace elements related to the sexual function. So these are all at the age of 63, 1.83 is sexual function. So these are the ways that one can improve their lifestyle. Because we are always looking for ways to help ourselves. So this is one. These two tests combined with regular form of treatment that you are doing, maybe allopathy, sujok, acupuncture, acupressure, whatever you are doing, these methods can give you a larger dimension of making you understand the shortcomings in you. Of course, you should don't take these tests as final. If they are deficient, we could always check up in the laboratory. That's what I've done to one or two clients. When we've seen problems here, after I've recommended going in for lipid profile tests and all, because I've seen that the liver is not functioning properly. I said, please do your liver profile, kidney profile, because once we get those kidney profile and liver profile, they will cross tally with these reports, because those are physically done. This is done within 60 seconds by just holding it. So this is through very high quantum physics, resonance technology. So there is one more which is available where you put it in the head and it gives some ultrasonic beams, and that also gives you such reports, but that is very expensive. That's around 1.5 lakh rupees. So many products are available, and they use different methods of analyzing the human body, because it's all done through quantum physics. So this is also what you did. You just held it on, and through the resonance of the body, this is analyzed there. So this is quantum resonance technology. So through the resonance of the human body, with this technology. So it's a very, I would not say it's too refined, but it's a good way of, fast understanding when you're having so many clients.
And there is a difference between body vibrational frequency and brain vibrational.
Yeah, ultimately, brain is in the body only. No? So the brain has a different parameter, body has a different level. So they all work together. You can't say brain is different and body is different.
So we can find out the human behavior.
Through this, no, you can't analyze human behavior. You can analyze his body structure, no? Different organs.